Singapore's healthcare AI push targets administrative overload, with clinicians spending over half their time on documentation rather than patient care. Here to expound on this are Dr. Ling Zhengzhe of National University Hospital and Dr. Anindita Santosa of AIGP Health. Glad you could both join us. Let's begin with the cause. With admin consuming over half of frontline workers' time, why has automation taken this long to deploy? Dr. Anindita?
Yes. I think actually, healthcare has actually digitized much faster than it has actually automated all this while, right? So we have electronic health records, portals, claim systems, referral systems, scheduling platforms. But many of them were still not talking to each other at the beginning, and we are starting to change that quite a fair bit. Yeah. Unfortunately, with all that, a lot of healthcare workers became integration layers, and so there were many clicks, many types. And so, in fact, digitization actually increased manual work, not really through automation, right? The reason why it's taken so long in healthcare is because we usually don't just try to apply technology on a bad workflow. It actually required healthcare to reassess our workflows to make sure that when whatever technology we do apply, it does improve the overall outcome and reduce all that manual work that needs to be done.
And do you agree, Dr. Zhengzhe?
Yeah, so Ani brought up a great point about the healthcare staff being the integration layer. And I think one of the reasons for that is because unlike most other industries, our processes must be safe, reliable, and secure. And our workflows are quite complex, right? Most online or digital workflows you see today are very nice and straight, right? Like retail, ordering food. You place the order, the sequence of steps is always the same. That's not true for healthcare. And then there's also the human element of warmth. You don't expect your online retailer to give you that element of warmth and reassurance, whereas that's something that, if you are too focused on efficiency and speed, it can come across as a bit cold. And I think one of the key things about what has happened in the last 2 years is that we actually have the digital foundations, like Anin pointed out, to scale AI responsibly. So, in NUH, we are guided by these two principles of digital as default and that everyone is an innovator. So to us, automation and AI are not capabilities that are limited to just special people or the very smart people or the tech people. We made it available to everyone at every layer, and we want it to really change their workflows. And so to that end, in NUH, we've trained over 47% of our staff in tools like Copilot and Microsoft Power Automate, which is like, and we are actually tracking the usage of this. So we have about 2,100 staff that have already used it. That's almost a full quarter of my my staff strength using it last month, right? So we are tracking this quite actively. And I think we also trust our staff a lot. They are highly trained. We let them decide what are the tasks that can be streamlined, and we let them tell us what are the things and the capabilities that they want us to enable. So it's not about whether we can automate or not. It's actually about making sure that automation spreads reliably and at scale across our entire care spectrum. Yeah.
But with HSA's sandbox, does it give providers enough room to move fast, or is it still too restrictive?
Okay. So I think we probably need to frame this a bit with some nuance, yeah, before we answer. I mean, the sandbox is mainly about AI that functions as medical device. So if you're talking about AI copilot, maybe to automate certain administrative things, that doesn't really fall under the HSA sandbox per se. All right. And so, really, where the sandbox plays a part is for systems that may influence diagnosis or clinical management. And I would not say that the sandbox is the main reason that administrative automation has been slow. Okay, so we do need to defer that quite a fair bit. I do think that the sandbox is actually quite constructive because it gives providers a pathway to evaluate lower risk clinical AI with safeguards. Ultimately, in healthcare, we're talking about patient privacy, patient data privacy. We're talking about risk mitigations and making sure that no harm is done to any of the patients, right, through the technology. So I would say in healthcare, safety and speed are not necessarily opposites, and good governance is what allows innovation to scale with confidence, right? So, yeah, I mean, yeah. And so, really, the bigger barriers are often the interoperability, procurement, workflow fit, clinician trust, and change management. I think, yeah. So ultimately, that takes a lot more time, and I don't think the sandbox is the bottleneck for most administrative automation. Yeah.
So I completely agree with Anin here. I think she made a very good distinction between what the sandbox is meant to focus on, which is software as a medical device versus the administrative aspects of it. And governance is the enabler for speed and scale. Even when we train our people in use of certain tools, right? They also ask us, what are the rules around this? Is it safe? Have you checked in with HSA, MOH, our own internal governance? So having that clear signal from HSA, especially in terms of software as a medical device, really provides that reassurance to providers that there is regulatory attention and that there are rules around it. And frankly, even if we streamline the regulatory requirements, there are other requirements that need to be addressed, like Anin pointed out, safety, cybersecurity, privacy, our own operational readiness. So I think when it comes to speeding things up, it's a multifactorial thing. And here, at least, we made sure that our AI governance allows us to evaluate the solution safely and still keep things open for innovation, because like I earlier mentioned, our tools are not limited to just techies or smart people. We want it to be available to clinicians, nurses, allied health, operational teams, our frontline counter staff. We want them to be enabled and empowered. So we're actually very happy with the HSA sandbox, because it allows us that chance to really define, like, hey, this is something that's a software as a medical device. And the public and the patients also have confidence when we say, hey, we are part of a sandbox. This solution is part of the sandbox also. And that the element of trust, I think, is absolutely critical for public healthcare. Yeah.
But overall, let's say generally speaking, can AI realistically cut waiting times, and by how much? What's your take on this, Dr. Anindita?
Okay, so I will bring my perspective as a clinician from who worked in public and private healthcare as well as AIGP CEO here, right? So I would say yes, but I would be very careful about promising one universal percentage, yeah. So if you think about it, the waiting time that patients face is not created only inside the consultation room. It's actually a systemic issue, right? It's created across appointment scheduling, registration, triaging, insurance checks, or health financing checks, retrieval of records, consultation preparations, investigations, pharmacy referrals, and discharge. So across end to end of the patient journey, right? So while AI can potentially help predict demand, smooth scheduling, automate some of the pre-visit information collections, support triage, summarize records, or reduce documentation burdens and streamline downstream workflows, I don't think it necessarily makes the doctor faster all the time, and neither is that what we should try to achieve, right? We should achieve a system that works faster around the doctors and our other healthcare workers, I would say. Yeah. And so, I mean, in your brief, there was this mention of 72-minute figure, which is probably the 95th percentile of doctor consultation waiting time. Yeah, it's actually much shorter than that. Median, I think, is 8 minutes. Yeah. So the real operational challenge is really the long tail, right? Why some patients experience much longer delays. So as to how much AI can reduce waiting times, I think it depends entirely on the bottleneck, depending on the setting and the system, and there are certain human factors in play as well, right? Patient factors, doctor factors, and everything else. Yeah.
Yeah. So thanks, Anit. So you covered the outpatient waiting time very well, right? And the different steps that are there. So even waiting time, there's different kinds of waiting time. There's wait time for admission, there's wait time for first appointment. And I think there are benefits in terms of automation and AI that can help in those. And we are also in this scenario where we're just trying to improve on what we already have. But how can we completely redesign the way care is delivered? The best waiting time is no waiting time at all. And to me, that means that maybe if there isn't a need for the visit, there shouldn't be an in-person visit. And in that way, we restore the value of that in-person physical time between patient and provider. We're respecting the patient when we say, hey, we want you to show up because it's important, right? If it's a visit that's purely just for one-way information download, or a visit that says, your results are normal, congratulations, maybe we shouldn't even have those consults at all, unless it's like a major milestone where you're saying, hey, you're cancer free. But other than that, routine blood tests, result normal, I think there are other ways of valuing the patient's time by saying, hey, you don't need to come back. But if you do, you can let us know. But for now, you don't need to come back, right? So it's not really just about like speeding things up on the doctor's end. And I'm also a user of like AI scribes and everything. And I think the main benefit for me has been in terms of the ability to being able to focus on the patient. I can talk to the patient, look them in the eye. I don't have to like distract myself with my typing or like think about the right word to document whatever the patient said. I talk to my patient naturally. I stop the recording when the patient leaves. I place a few orders, the transcription and the summary is ready for me. I make sure that the notes are accurate, then I can move on, right? And that's just an example of the everyday productivity that is already happening here at NUH. It's really a part of our lives. Almost all of our meetings are transcribed, speech to text. We try not to make people take manual minutes anymore. And we're also expanding some of these information retrieval tasks like compliance with policy, contracts, templates. We try and build it in as agentic agents so that those things can be done faster and allow the human to really focus on like the content of the material as opposed to formatting things to make sure that they comply with a certain template. We're also doing other digital care models, right? Like remote monitoring, digital follow-ups, like I mentioned. If you don't have to come in, don't come in. So like I think it's not really about like a universal percentage reduction. I think it's about us being able to care for more patients better with the same workforce and also being able to direct patients to the right channel of care. And then when that happens, maybe you get a shorter queue. But I think we shouldn't be focused so much on the waiting time that people feel very stressed to comply. Yeah.
Thank you so much for sharing your thoughts on this topic, Dr. Zhang Jie and Dr. Anandita.
Yes. Thank you for having us.
Thank you for having us.
Once again, those are Dr. Ling Zhengjie, Chief Medical Informatics Officer at National University Hospital, and Dr. Anandita Santosa, Co-founder and CEO at AIGP Health. For more news, visit healthcareasiamagazine.com.